Member for Oakville.
Thank you, Mr. Speaker. I'm honoured to rise and speak in support of Bill C-45, an act respecting cannabis, and to amend the Controlled Drugs and Substances Act, the Criminal Code, and other acts. The principal objectives of the act are to prevent young persons from accessing cannabis, to protect public health and public safety by establishing strict product safety and product quality requirements, and to deter criminal activity by imposing serious criminal penalties for those operating outside of the legal framework. My constituents in Oakville have expressed that these concerns need to be addressed, and I believe that C-45 does exactly this. As a member of the Standing Committee on Health, I would like to report, Mr. Speaker, the committee undertook a comprehensive review of this bill. We took a focused week, meeting for 5 full days to hear testimony from a wide array of individuals and groups. Mr. Speaker, we heard from over 100 witnesses on this bill. Witnesses range from lawyers, law enforcement, department officials, tenant associations, community groups, activists, medical professionals, researchers, producers, retailers, and provinces. This built on the Task Force on Cannabis Legalization and Regulations work, which traveled for 6 months and received over 20,000 submissions. The committee heard from most witnesses that they supported the direction the government was taking with Bill C-45. So based on this background, I would like to focus on why a new approach to cannabis is needed, why we need to act now, and address how well suited we are to moving forward. The evidence is clear. The current approach is simply not working. All that we have managed to achieve is to criminalize Canadians for possessing small amounts of cannabis, encourage Canadians to engage with criminals, and require Canadians to consume products of unknown origin, potency, and quality. It's also allowed criminals and organized crime to profit. The committee heard quite clearly that the current model has not protected our youth. Despite the prohibition that's been in place for decades, Canadian youth use cannabis at some of the highest rates in the world. We cannot allow this to continue. A new approach is required as soon as possible to better protect youth and to make sure that adults have access to products that are quality controlled and of known origin and no longer run the risk of having a criminal record for possessing small amounts. During the committee hearings, Mr. Ian Culbert, the Executive Director of the Canadian Public Health Association, said, "Unfortunately, we don't have the luxury of time, as Canadians are already consuming cannabis at record levels. The individual and societal harms associated with cannabis use are already being felt every day. The proposed legislation and eventual regulation is our best attempt to minimize these harms and to protect the well-being of all Canadians. And that's why our government is committed to bring the proposed legislation into force no later than July 2018. Upon the coming into force of Bill C-45, Canadians who are 18 years of age or older would be able to possess, grow, and purchase limited amounts of cannabis for personal use. It would mean that possession of up to 30 grams of cannabis in a public place would no longer be a criminal offence. The bill would, for the first time, also make it a specific criminal offence to sell cannabis to a minor and create significant penalties for those who engage young Canadians in cannabis-related offences. Mr. Speaker, Canada is more than ready for a new approach that would better protect the health and safety of Canadians. Our existing model that provides access to cannabis for medical purposes is recognized as one of the best in the world. So let me tell you about some of the features of that system that we can build on. Under the existing regulations that have been in place since 2014, Health Canada is responsible for licensing and overseeing cannabis producers. These producers are required to operate within the regulations to provide quality-controlled cannabis to registered patients. The rigorous licensing process ensures, for example, that entrants to this market have gone through a thorough security check and that producers have appropriate physical security infrastructure around their facilities. Canada also has a world-class compliance and enforcement regime intended to ensure that licensed producers fully comply with the rules in place. Over the course of last year, a licensed producer in Canada was inspected an average of 7 to 8 times for a total of approximately 274 inspections. In May 2017, Health Canada announced that it would require all licensed producers to conduct mandatory testing for the presence of unauthorized pesticides in all cannabis products destined for sale. This adds to the system of controls in place that oversee the quality of federally regulated cannabis products. The commercial industry now has more than 4 years of experience, serves over 200,000 active patient registrants, This licensed production under the existing medical regulations provides a solid basis to support recreational cannabis production under this bill. Industry representatives have indicated that they are getting ready to support the timely implementation of the new regulations and to ensure that high standards are met in the production of regulated product. Mr. Speaker, the committee also heard that while our government has been working very closely with provinces, territories and municipalities to support the implementation of the new framework, more work is needed. The collaboration will be critical to ensure that all levels of government are ready to support the new legislation, and we were pleased to note that progress is being achieved by our provincial and territorial partners in developing their respective approaches. Provinces and territories have a key role to play in the success of the new system. They are responsible for the oversight and regulation of the distribution and retail sale of cannabis. Timely passing of this federal law is important to provide clarity to our provincial and territorial partners. In circumstances where provinces or territories do not have a functional retail system at the time of coming into force of the bill, adults would be able to purchase cannabis directly from a federally licensed producer by ordering online with secure delivery at home by mail or courier. A representative from Cannabis Canada Association, Colette Rivette, pointed out that licensed producers are eager to work in collaboration and compliance with the federal and provincial governments to quickly establish effective, low-risk distribution and retail models that are well-regulated, highly secure, and tailored to the needs of each province. Mr. Speaker, upon the coming into force of the bill, adult Canadians would have access to a range of quality-controlled products, including dried cannabis, fresh cannabis, cannabis oil, which could be consumed in a number of ways, including smoking. The committee heard from health groups that limiting legal cannabis to forms primarily suited to smoking had negative health impacts. They identified the need to permit the legal sale of edible cannabis products as part of a federal framework as soon as possible. The committee also heard expert testimony that experience in other jurisdictions, such as Colorado, underlined the unique health and safety challenges associated with edible products. It's important that our government takes the time to enact appropriate regulatory controls to address the health and safety risks posed by edible products. In this regard, I was pleased to introduce an amendment to Bill C-45, which clarifies the timelines for the government to develop regulations and legalize the sale of edible cannabis products and cannabis concentrates. The amendment stipulates that the sale of edibles and concentrates would be permitted no later than 12 months following the coming into force of Bill C-45. Under this proposed timeline, the government would have the time to safely develop regulations and mechanisms to put these edible cannabis products on the market correctly. Mr. Speaker, I think it's important that we let Canadians and the industry know that we are listening and that these products will be coming. However, we must heed the advice from other jurisdictions, get this right the first time, and not put the health and safety of Canadians at risk. Mr. Speaker, as I mentioned earlier, one of the purposes of Bill C-45 is to prevent youth from accessing and consuming cannabis. Yesterday, the government announced a $36.4 million investment for a cannabis education and awareness campaign aimed in particular at Canadian youth to ensure that they understand the health and safety risks of using cannabis. Young Canadians need to know the facts. The bill contains a range of provisions that would restrict promotion or packaging that could make cannabis appealing to youth. For example, the bill would ban the advertising and promotion of cannabis except in limited and restricted circumstances, as well as set out requirements for packaging and labeling of products. So as I've outlined, protecting the health and safety of Canadians, most importantly the health of our youth, is at the centre of our government's approach to legalizing, regulating and restricting access to cannabis. The Government of Canada is committed to a comprehensive, collaborative, compassionate and evidence-based approach to drug policy, which uses a public health approach when considering and addressing drug issues. I believe that's consistent with the wishes of the people in my riding of Oakville. I am confident that this public health approach, which focuses on reducing harms and risks of cannabis rather than on criminalizing Canadians for possession, is the best path forward for us. Thank you, Mr. Speaker.
Questions and comments. The honourable member for Sarnia-Lambton.
Well, thank you, Mr. Speaker, and I'd like to thank the member from Oakville for his speech and for his work on the Health Committee. In his speech, he talked about how the Liberal government decided to delay, because of the health and safety risk, delay by a year the introduction of edibles. And so I wonder why they're willing to delay and slow down, because they recognize the risks there. When they've said they're going to follow also the advice from other jurisdictions who clearly told us the public awareness and education needed to be done before legalization, police needed to be trained before legalization, provinces and territories should be ready, and none of those things are in place. They've only been announced. So will the government delay the implementation until they're properly ready to address the health and safety risks?
Member for Oakville.
Well, thank you very much, Mr. Speaker, and I thank the honourable member for her question and congratulate her on her excellent work on the Health Committee as well. So we heard very clearly from other jurisdictions, Colorado and Washington, who tried to introduce legalized cannabis along with edibles at the same time, that it had been a major mistake for them. They highly recommended that we go slowly with edibles. There's a whole other set of laws and regulations and requirements around safe production of edible products. And they encouraged, the best advice we had from experts was move forward with legalization, move forward in slow, steady steps, add the edibles at a later date when we were ready. So we really were following the best advice from the experts that we heard at committee, Mr. Speaker.
Questions and comments. L'honorable député de...
The honourable member for Sherbrooke. Thank you, Mr. Speaker, and thank you to my colleague for his speech. My question has to do with the way that the government treated the provinces throughout this process which will lead to legalization in the near future. A lot is being transferred to the provinces, whether it has to do with regulation that they will have to implement after legalization, or dealing with the distribution networks, or all of the costs that may be associated with public health issues linked to legalization. So I wanted to know if he's been satisfied with the province's reaction so far when it comes to his government's legalization proposal, and whether he thinks that the government is going in the right direction. And I'd like to know what, in his opinion, would be the best way of solving this this problem, because the provinces are saying that things are moving too quickly and that there's going to be an enormous burden transferred onto them as we modify the criminal code here in Ottawa.
Thank you very much, Mr. Speaker, and I thank the honourable member for the question. So at the provincial level, there is the bill looks to the province to regulate distribution and retailing of the product. But if a province or territory is not ready at the time the bill comes into force, as I said in my remarks, Canadians will be able to procure in those provinces or territories directly from licensed manufacturers through online systems and receive products confidentially in the mail or by post, which is exactly the model that we use across Canada today for medical marijuana. Otherwise, you know, the government we campaigned on this in 2015. The task force traveled for 6 months. Their recommendations have been out for at least a year. The draft legislation has been before the provinces and territories for some period of time now. Some of the provinces and territories are already responding and already making good progress in this. Others are still working through the situation, but there will be a legally available retail distribution model available at the federal level if a province or territory is not ready when the bill comes into effect. Thank you.
We have time for a 30-second question and a 30-second answer. The honourable member for Gatineau, question and answer.
Thank you, Mr. Speaker, and I thank my colleague for Oakville for his excellent speech. As a member of the Standing Committee on Health, could he tell us, I mean, he spoke about the experience in Colorado and in Washington, so could he tell us the experiments that they had and the experiences on which the committee's recommendations were based.
Member for Oakville in 30 seconds or less, please.
Well, I'll just, the biggest soundbite I can give you from the expert testimony from Washington and Colorado is they have moved organized crime out of the business. So close to 80%, 70 to 80% of the product that's sold now in those states is done through licensed, controlled distribution methods, as we are proposing here in Canada, and organized crime is being pushed out. So I think that's, and we are, the advice that we're taking in this bill follows exactly that advice, and I think it's the right course of action to get organized crime out of our neighborhoods. Thank you.
Right on.
Resuming debate, the honourable member for Simcoe Grey.